There are 4 new cases of the disease, including 2 healthcare workers who tested positive for the virus, and a medical centre in Brighton on the south coast of England is now closed. Overall, there are 8 confirmed cases in the UK. For more on this, let's speak to Dr Richard Dawood. He is a specialist in travel medicine, joins us live via Skype. First of all, what does this declaration from the Health Department mean?
Well, we're now entering uncharted territory because it's actually a very, very long time since quarantine laws have been invoked in this country. But basically, the new escalation of the level of public health threat that has been declared gives the public health authorities the right to legally detain people in order to prevent the spread of disease.
When you say it's been a while, how unusual is this, particularly within the region? Are there other countries in Europe implementing these measures?
I'm not quite sure what's going on in other countries, but the last time we had quarantine legislation enforced in the UK, in the mainland UK, you've got to go back as far as the plague outbreaks of the 1600s to find actual quarantine being enforced. There was a village that famously quarantined itself in 1665. There's legislation that dates to the 1700s as a result, but that was never used. There's legislation that relates to shipping, and the last instance I can find of that was in the 1890s when ships returning from overseas were quarantined.
Right. So that really puts it into some historical context for us, doesn't it, in terms of what prompted this declaration. Now, how important is it that these new cases came into contact with someone that was a previously confirmed case? So, in other words, there's been a lot of debate about these so-called super spreaders, people that really do shed quite a bit of the disease, and that can really accelerate transmission.
So at the moment, the quarantine rules predominantly apply to people who have been brought in from China, and particularly the emergency rescue flights from Hubei province. So initially, there was a kind of an individual contract that was offered to each of the people who was returned. So the issue is that it's not much fun being stuck in quarantine. I'm sure that there are lots of things that would add to anxiety, such as concerns about possibly becoming infected by contact with a fellow quarantinee. So it's not surprising that people feel the need or the anxiety and want to kind of discontinue this arrangement. That's really what's prompted this escalation. It's not that the threat has changed so much as the willingness of people to remain, and 14 days is a long time to remain under quarantine conditions.
Appreciate your time. Thank you very much, Dr Richard Dawood.